Five Wishes is pleased to welcome you to today's webinar, Gaining Traction, Increasing Value and Support for Your ACP Program. My name is Kate, and it is my pleasure to be the facilitator for today's event. I would like to formally welcome the participants joining us today. Please note today's call is being recorded and all participant lines will be muted during this broadcast. If you experience technical difficulties with the web portion of today's program, please email 5wishes@compartners.com or send a message in the chat box. If you are listening to the program over the phone and you need assistance at any time, please press the *0 and an operator will assist you. This presentation will last up to 60 minutes and will include a question and answer opportunity at the end. You may submit a question at any time by chatting in the chat box on the lower left corner of the screen and clicking the send button. I would like to direct your attention to the links box located on the left of the screen, where resources are located for you to view, save, or print. Simply click on the link of your choice and a separate web browser will open. This will not interfere with your program. It is now my pleasure to introduce the speaker for today's webinar. Lori Jackson is a Senior Director for Compass Care at Virginia Mason Memorial Hospital and holds a master's degree in divinity and a master's certificate in clinical ethics. Kathleen Taylor is the Healthcare Advisor for Five Wishes, and Paul Malley is the President of Aging with Dignity. At this point, I'll turn the presentation over to Paul.
Thank you, Kate, and thank you to each person who is participating in this webinar, whether you're participating live or if you're joining by recording. We're grateful to have you, and we give you our thanks and our welcome to this very first Five Wishes Practice Community webinar. The title is Gaining Traction, Increasing Value and Support for Your Advanced Care Planning Program. You may hear us mention ACP, that's what that means, Advanced Care Planning Program. And whether you're joining this webinar, if you work directly in healthcare, this is particularly aimed for you. If you don't work in healthcare, then that's fine, you can still join us. But I hope you'll contact us at Aging with Dignity and Five Wishes for more information about your specific area of focus. Over the years, we've certainly been grateful to work with faith communities, workplaces, professional advisors, just about any other group or organization to spread the word about Five Wishes. Our aim at Aging with Dignity is to support all of your work and efforts. But this particular webinar is geared again specifically for those working in healthcare. While those of us gathered on the webinar and participating come from all parts of the country, we have all corners covered, almost all states, international participants from Canada and Australia joining us. We work in a variety of healthcare settings, but there's one thing that unites us all, this heart of advanced care planning and I think really a desire to serve and care well for the people who we're responsible for, whether that's patients, clients, members. That desire to care well for the folks around us. There's something about having a conversation with a person and finding out what matters most to them, how their values shape their decisions, and we know that connects us to what's truly healing and just genuinely good about healthcare, especially near the end of life. As we begin this discussion today, I hope you'll take just a few seconds now to think about who you serve, the people you serve, when you are the one who's having these conversations, and about how these conversations can offer important moments of clarity, connection, and really humanity, about shedding light on who the person is who you're caring for. You know, when we first introduced Five Wishes, we had no idea if people would be interested in it. We didn't know. We thought if it could help a few people, that would be wonderful. And today, thanks in large part to you, our healthcare partner organizations, we've reached more than 35 million people with Five Wishes. So a genuine thank you to you. Thank you for being part of the care teams or the outreach teams or the administrators who get Five Wishes into the hands of the patients and the families that you serve. We're grateful for you. Now, many of you I've had the pleasure of meeting personally over the years, and the rest of you, I definitely look forward to getting to know you more. Just a few months ago, I visited with Lori Jackson in Yakima, Washington, the complete opposite corner of the country from our Florida office. And Lori is with us on the webinar today, and she'll provide an example of how to begin with really just a few small, easy steps that can help lead you to a fully integrated community program that has wonderful impacts for your patients and families, as well as all stakeholders in healthcare. I think, as all of you know, since you're on the ground doing this work, 5 Wishes really seems to work exceptionally well in healthcare settings. Though it started as a consumer-geared advanced care planning document, it's been embraced widely in healthcare settings for some of the same reasons that it's worked well as a consumer and a family tool. It makes sense. It's simple, it's easy to explain, and it explores the things that really matter to people when they're thinking about care at the end of life. Today, 5 Wishes is a full program for healthcare, and we intend, with your help and with your guidance, to keep building the tools that you ask for to make your work more effective, more meaningful, and more efficient when we can. Our ultimate goal is, and it always has been, to help preserve human dignity for those who face the challenges of serious illness, particularly near the end of life, to help each person know that they matter, that someone cares about them as well as for them. And we've heard amazing stories from you about the patients and the families that you serve. You've told us about helping families feel like good caregivers for their loved ones, not just because they knew who a healthcare agent was or the specific wishes about life support treatment, but even more because they talked about what was important to their loved one as a person. So we thank you genuinely for your work and for sharing your stories. We always want to hear more. We always want to learn from you and to support you. And that's why we're happy now to have this, the 5 Wishes practice community, which is led by Kathleen Taylor, who I'm about to turn this conversation over to. Kathleen is part of the 5 Wishes team. She serves as our healthcare advisor and leads the 5 Wishes practice community. She's worked in the healthcare field for over 27 years, and she knows advanced care planning as a clinician, a community outreach professional, a clinical trainer, an advocate, and importantly, as a family member. And we're fortunate to have her with us. So with that, I'll hand it over to Kathleen.
Thank you, Paul. I appreciate that. And I can't believe we're finally doing this webinar. I'm so excited to have all of you here today, and I'm excited to be here with you. What I'd like to do to get us started is talk a little bit about the 5 Wishes practice community and what that is and why we launched it this year. So as you can see on the screen, I hope, here's a little definition of the 5 Wishes practice community. It's a collaborative community of healthcare professionals who use the 5 Wishes program for advanced care planning. And by that we mean any components of the program. So you might use just the document, you might use the training, or you could use any or all or just one thing. But it's anybody who's using any components of the 5 Wishes program. And our goal with the practice community is to enhance your outcomes and elevate your practice through sharing best practice stories, resources, information, and more. So the idea is to help you be more effective at what you're doing with 5 Wishes tools and with advanced care planning in general. There are several tools and resources that are part of the 5 Wishes program for healthcare, and you saw some of them scrolling through when you logged on today. There was a little blurb about the conversation guide for clinicians and another one about the conversation guide for individuals and families. Of course, there's also the document and the online training and many more. And some of you may be actively using these 5 Wishes tools, and some of you may have used them in the past, but you're not currently using 5 Wishes tools right now. And that's okay. We hope you're using the tools because we know that they'll elevate your practice. But the real core of the 5 Wishes approach and philosophy is about decision-making conversations that are centered in humanistic values. It's about an approach that's compassionate and effective when it comes to conversations that help you discover and rediscover what matters most to the person in front of you at every stage in their life and at every point in their healthcare journey. That's what the 5 Wishes tools support, and that's the approach that the 5 Wishes practice community is all about. And we want this practice community to be a touchstone for you about the human connection in delivering healthcare. And I know advanced care planning is not a panacea, I know that. But I will say, when it's done well, it really can be an interaction between patient and clinician where that human connection can be modeled. And it's a service that's appropriate for all levels of care in all care settings. When we do it well, we help create care that's consistent with a person's values and their wishes, and their decisions for their own care actually get documented in a chart. And I'm not really sure where else a person's own values in their own words get documented in the medical record. So when advanced care planning is done well, we believe that it can help us as clinicians experience the joy of practice, because connecting with people is really what we all meant to do when we entered healthcare. I think it is. So with this kind of approach, advanced care planning can be one activity that fosters humanity for both the patient and the clinician. So we want this practice community to be practical and in some ways inspirational for you. And I know it's just the practice community and it's just advanced care planning, but you know what? It's really not just either of those things. I think we have an opportunity to make it anything that we want it to be. So I want to tell you a little bit about some things that we know. In the spring of this year, we sent out an invitation to all of our healthcare partners to participate in the first 5 Wishes Practice Community Survey. And some of you on the webinar today may have participated in that. We're really grateful to you for that. We're grateful to everyone who took the time to provide feedback. And I'll tell you that we read every single survey backwards and forwards. Your responses are helping us shape what we offer. And in fact, those responses were the inspiration for this webinar that we're all part of today. And I want to share a few things that we learned from your responses to the survey. One of the things that we learned is about how you use 5 Wishes. And what we discovered is that over 80% of you who responded to this question are using 5 Wishes tools for patient care, and about half, just over 50%, for community education and outreach activities related to advanced care planning. Many of you are also using 5 Wishes resources for clinical or professional education and training, and that's probably usually our online trainings or our conversation guides for clinicians. And others of you are using 5 Wishes tools for professional or referral partner outreach. And usually those are things like customized 5 Wishes documents or our physician toolkits that people give to physician offices or other referral partners. So that's what we know about how you're using 5 Wishes. Another thing that we learned is that less than a quarter of people consider their advanced care planning to be formal, which I will tell you was a surprise to me, and I've been playing around with this advanced care planning stuff for a really long time, but yeah, it's a really low percentage of people who consider their program to be actually formal, so endorsed and supported by an organization. And then if you look at this slide, we also learned that only about 23% are measuring the results of their advanced care planning efforts. 77% of people who responded to the survey said they're not measuring results of their advanced care planning activities. Now this number is suspiciously similar to the slide we just looked at, which I'll go back to real quick. We have 76% informal programs, and we have 77% of folks not measuring their results. That seems suspiciously correlated to me. My hypothesis is that having a formal program probably helps people measure the results of what they're doing because they have the support to do so. So what we learned from all of this is that most of you need help with these things: gaining organizational support for your advanced care planning programs and developing meaningful measurements to demonstrate the value and impact of what it is that you're doing. And these two things are kind of a chicken and egg situation, but we're going to talk about both in our webinar today. So the objectives for today are these. We're going to learn how to make a compelling case for engaging in advanced care planning initiatives. We're going to learn about the importance of gaining support from a champion and a sponsor, and we'll talk about what those words mean. And we'll get some tips on how to identify advanced care planning projects that can help demonstrate success and give you something to build upon. So with these objectives in mind, we invited Laurie Jackson to be our presenter today. And as was mentioned earlier, Laurie is the Senior Director of Compass Care at Virginia Mason Memorial Hospital in Yakima, Washington. Laurie started as a staunch advocate for advanced care planning using a 5 wishes approach like we talked about earlier. And she started as someone who experienced firsthand what good advanced care planning conversations could do for patients and families and clinicians. And in what she's done, she's gone through a journey of building an incredible advanced care planning program that now extends throughout their system with data that supports everything they do. We are tremendously grateful to have Laurie as a 5 Wishes ambassador and as our presenter today for the webinar. So with all of that, I will hand it over to you, Laurie.
Thank you, Kathleen, and I want to echo your words and those of Paul. Thank you for joining the webinar today. I know your time's valuable, and so I really hope that the information that I might be able to share will be valuable to you as well. Next slide. We want to make a compelling case for you and following those objectives. Kathleen, may I have the next slide? We're wanting to align your program to what's important to those that you serve and to your organization. You can see that this is Virginia Mason Memorial's strategic plan. You want to understand what's valuable to your organization, what the bigger picture is, and what the language is for your own strategic imperatives. We focused on these strategic focus areas, and for advanced care planning, it comes as no surprise that advanced care planning meets almost all of the strategic focus areas, at least of our organization, and I'm guessing probably of yours as well. We focus on that experience for our patient. We want to do what is best for them. We want a relational model of medicine. We want to focus on the people that are providing the care as well. What is the best and easiest method for understanding what patients want? We have learned that community health is crucial in today's healthcare system, as well as simply for our communities to thrive, and advanced care planning is a major part of that. And we know that having community members that have a plan in advanced care planning are better suited for living lives of peace and less fear, and the cost of care is actually better for them as well as for the organizations. You're going to be making a case to somebody that has at least one of these strategic focus areas or one of your own that may even be better, that's on their mind. So as you are making that compelling case, make sure that you are speaking in the language that they can understand, and you probably already are, and you can even pick that up a little bit too, so that those that are affecting the workflows and those that have influence can be really bought in and brought in to the conversation, because these are their goals as well as yours. May I have the next slide? We came up with some statistics that work for us. as you're making that compelling case, you always want to have some data in your pocket. And there is data everywhere, right? You can pick whatever you want. This seems to work for our organization. I use this slide a lot because advanced care planning is wrapped around every one of these elements. I'm going to go through them so that you can see where we use these different points of data. The majority of people when surveyed wish that they could die at home, but most don't. Most die in a skilled nursing facility, a hospital, or a long-term care facility. Most people want to have their wishes in writing, but you can see the majority don't. And the majority of Americans say that if they were ill, they would want to talk to their doctor, but very few actually do. This is great foundational information for making the case for advanced care planning. For why would we not make this easy for our community members to get exactly what they want? The bottom numbers are important for us for a couple of reasons. First, the bold one in the middle, this one just hits it home. If a person has an advanced care planning, they spend an average of 10 days less in the hospital during the last 2 years of life. I would like to know that for myself. And that alone is enough for me to get my family, my friends, everyone into an advanced care plan of some sort. The other two right above, the increased likelihood of prolonged grief and the likelihood of post-traumatic stress when a person dies in the ICU versus dying on hospice, is a direct result of having a plan. And not everybody that is without a plan misses hospice, and I completely understand that. But when you have a plan, the conversations come typically easier, which means that people can get to the right place at the right time more readily. We have been able to keep people out of the intensive care unit and get them onto hospice so much quicker when our patients have an advanced care plan. It makes it a lot easier to talk openly with loved ones and with patients when they've already done the difficult work beforehand. A spoiler alert, I say this whenever I am working with clinicians and students, that 100% of your patients are going to die. So if your goal is to cure people, then you're going to have a 100% failure rate. But if you change that trajectory a little bit and your goal is to help people live their best lives, then you can have a 100% success rate, because even as your patients are dying, they're living their best lives. And the more that you have conversations before there's a crisis, then the better off, the better we live, and the better off a patient is. Next slide, please.
I will move to the next slide, Laurie, and I just wanted to ask you really quick before we move on. These data points at the bottom of this slide are fantastic, and I'm looking at the attribution there. These statistics, these data are from Honoring Choices Pacific Northwest and California Healthcare Foundation, is that correct?
Yes, they are. Yes.
Okay. So if people wanted to look that up so they can make their own case, that's where they could find those data. Just wanted to point that out because I think these might be useful for a lot of you.
Thank you for saying that. And Honoring Choices Pacific Northwest is a group that has been working with the Gunderson system with respecting choices. So you can get a lot of that data with the Gunderson Health System as well. I'm glad you said that. Thank you.
And I think there's probably, well, I know there are other studies that link advanced care planning with a higher utilization of hospice. So that makes kind of a triangle with those 2 points about PTSD and prolonged grief with hospice. Advanced care planning just results in more frequent hospice referrals. So that's all I wanted to point out, and I will.
Well, you're exactly right, and we actually use those 2 data points about prolonged grief and PTSD to apply into our ICU. And so what we were doing for many years, what most people were doing, and maybe you've changed your practice already too, when we have a patient that is intubated for end-of-life care, and they're talking about withdrawing curative treatment and extubating the patient, we are having good conversations with those families and keeping them intubated, transferring them to an inpatient hospice facility where we extubate for end-of-life care, and we have found our numbers changing dramatically. There is so much less prolonged grief and so much less complicated grief and post-traumatic stress, because even in an hour of hospice, where we're just getting them over to this inpatient facility so the family can gather and we extubate for end of life there, it makes a huge difference. You can see the relief on the families' faces. So it's pretty powerful. I'm ready for the next slide. Thanks. You've probably seen this advancing illness diagram. I just beefed it up a little bit. We use this regularly as we're talking with families, and actually the best bang that we get for this buck is when we're talking to young people. We give this and we say that, you can see on the bottom left hand, there's a box that says 18 years and over. We start talking about advanced care planning as early as we possibly can and continue on through a patient's life and even into bereavement for the family. It kind of comes back full circle. This is how we describe what Compass Care does. We happen to have a home health, hospice, palliative care, inpatient hospice as well as outpatient. The Compass Care is also involved with the spiritual care for our entire system as well as our social workers. So I teach what Compass Care is based on the Advancing Illness Management diagram, but look at how important advanced care planning is to envelop the entire program. Understandably, at phase 4 and phase 5 on the right, we're doing more triaging when we're talking about advanced care planning. Often, the patients in stage 4, phase 4, they're hospice appropriate. They're 6 months or less typically. Often, if you work in hospice, it's often a couple of days, and that's crisis time. Every time that we back that up and practice advanced care planning lots earlier in creative ways, I'm not kidding when I say that it's actually fun. There are elements to that are so enjoyable that our community has, and we're a community of a couple 100,000. It's a broad community as well. People are not afraid to talk about, in our community, it's about 5 wishes. They still don't love the term advanced care planning. That can be confusing, but people are forever saying, I want to talk about 5 wishes. I want to have a 5 wishes party. We have 5 wishes party. I'll get to that later. That's an element of all of this, of making sure that we are backing this up and backing out and doing this much, much earlier before it's traumatic. Next page. In Yakima, I live in Central Washington State. You get free for attending this seminar, the understanding that in Yakima, Washington, it does not rain all the time. That's the Seattle area. We're right in Central Washington. It's desert area, very encapsulated area, but our county is 4,300 square miles, and we serve that entire county. 7 years ago, we didn't have a whole lot of advanced care planning. We have always dealt with, of course, the durable powers of attorney for healthcare and living wills, but we didn't have much going on formally for advanced care planning. And today you can see several of the things that we do. Because we wanted to make a compelling case, we started these things one at a time. And advanced care planning has made all the difference in this. We happen to have a foundation, and we'll talk about the difference between having one and not, but really, honestly, we sort of stumbled on some of this because we had an old and complicated advanced care plan for our hospital, and it wasn't working very well. It was really complex, and I found the 5 wishes, and we started using it. And then our foundation, I went to our foundation because I knew that they had money for advancing illness and end-of-life care, and I just asked them, hey, would you buy some for us? And they said, okay, we'll buy a few, use them sparingly. I don't really know what sparingly means. So I handed them out, and then started getting our registration folks at the hospital involved. And said, hey, instead of, their leader first, and said, hey, instead of using this 10-page complicated legalese form that neither you nor I can understand, how about we use this? And pretty soon, it was kind of organic how the foundation said, okay, you use all those, we'll buy some more. Okay, we'll buy some more. Hey, guess what? Now we're at the 100,000 document mark. And it wasn't that our goal originally was, hey, we want to get to 100,000, how about the foundation pay for it? It was one at a time. Our community is engaged in advanced care planning through lots of different activities, including these 5 Wishes parties. We have standards in our charting and standards for our staff that work in hospice and palliative care. We also utilize our chaplains. You saw at the beginning that I am a chaplain originally by trade, and I'm in a system with a 226-bed main hospital, and like I said, we have hospice, home care, we have a cancer center, we have a children's village, we have several clinics as well, and some urgent care clinics also. We had 1 chaplain for our whole hospital and 2 chaplains for hospice. Today we have a dozen staff chaplains. And one of the main reasons why we have them is they were trained in advanced care planning. I was able to get the data of the conversations they were having. We also then brought in all of the spiritual leaders in the community and said, we want to help give you the ability to have good conversations with your parishioners, with your congregants, or whatever it is that you call them. So we dangled a treat before them, and we said, if you come to a 3-hour training, and at first they balked at a 3-hour training, but then afterward, every single person that's done the evaluation has said it was well worth it. We gave them a badge as a spiritual leader badge that's part of the Virginia Mason Memorial System. So they can come in and they are part of the team. We use the data that they collect because they write notes after they've visited patients and put it in a secure locked box so that we can actually chart on that as well. That is what gave us the power to go to administration and say, look at all these people that are touching our patients. We want to train them, and then we did train them, and once we train them, we want to hire several of these, and we have regular chaplains as well as these volunteers and spiritual leaders, and they all get to do advanced care planning, and we keep them updated and educated. That's been huge. We couple that with the surprise question. You may know already what the surprise question is. That, would you be surprised if your patient died in the next 6 months? We have that as a standard in our computer charting. When a physician registers a patient, they answer the surprise question, and if they answer, no, I wouldn't be surprised if the patient dies in the next 6 months, the chaplain then goes in and has a starting conversation on palliative care. We also have a bereavement program that brings that advanced care planning in for family members. Next slide, please. For success, you need to have a champion. It doesn't have to be anybody fancy. If you knew me, you'd know I'm not fancy, but you got to have passion. And like you've already heard, this just started organically. It is not complicated. Look at the people that you already know. I happen to have my parents who are still living, and they live in this community. They are a tremendous resource for our program. They sell it on their own. They have these parties for us, and they've told 2 friends who have told 2 friends, and so on and so on. And that's how we've gained success. It has really been grassroots and one at a time. It hasn't been complicated. Next slide.
Laurie, can I ask you real quick because I think this is so important to have a champion. Can you talk a little bit more about what are some of the characteristics and roles of a really good advanced care planning program champion?
Sure. First is that from that slide, somebody with passion, somebody that sees the importance of it. It could be I'm responsible for all home-based care and bioethics and a couple of other things. It could be somebody that's an administrator. It could be a leader. It probably should be someone who's able to leverage those relationships. So if there's let's say a floor nurse that's super excited about that, they can get that started. It would be great to connect them with somebody who has connections toward an upper level on some level. But it can be really anyone to start. Our chaplains are the ones that really make it work on a day-to-day level for us.
Okay. One of the things I notice is that wherever we go and talk to people about their advanced care planning program, this is the place where there's probably the most variety is in who's actually leading them. And sometimes these leaders are formal, and most of the time they're informal, but it's everything from the oncology floor to the social work folks, to the discharge planners, to the palliative care nurse team. I mean, it's really it always kind of ends up that somebody is sort of a natural champion, or there's a place it makes the most sense for it to land. So I think you're right, it really can be anybody. But with the things that you just mentioned, I hope our participants can take just a few seconds and answer this question real quick. With what we've been talking about, can you identify a person, even if it's you, who could be your advanced care planning program champion? And just take a few seconds and click the square next to yes, no, or not sure. And yes, some people are not sure. It's not always easy to figure out who it is, and some of those concerns tend to be around who's got time to do this. Again, it's the chicken and egg thing. Who's going to have support and endorsement to do this? And hopefully, as we go through some more of the stuff that we talk about today, we'll get to a little bit about how you can get started. If you're the champion, probably most of you who said yes think you actually are that person. That's my guess. So it looks like most of you can think of someone, and a few of you are not sure. So I like it that nobody said no. And with that, we'll move on to another thing that's needed for success. Laurie?
Okay. I don't want to lose some of this. I want to make sure that you're able to get the meat of this. For success, you want a sponsor, somebody that has some financial buy-in from your organization. You can see that some organizations have ways to get small grants. I would apply if I was you. If you have a foundation, that's fantastic. Start small. You don't need a lot of money in order to get going on this. I mean, you already know about the 5 wishes. You don't need a lot. In fact, most of the time it's for printing some extra materials. If you need some staff training, the leaders were talking a couple of days ago about how food is an essential element to several meetings. So having some of that money for getting people interested, getting them involved. Maybe you're going to be at the senior center. That may take a little cost. But it's not a lot that you need, but some financial buy-in is crucial for this. Perhaps you're doing it by fundraising. There are lots of different ways where you can get some buy-in, and sometimes it starts with a small amount for your organization to then see the value and then invest. That can feel challenging, but it's not as hard as it may sound. If you have not done that before, start with something, anything, and see what can go from there. Make sure you connect with what matters. for the organization. We go back to the strategic plan, look at current projects as well, and use that data that you already have to apply in the language of the people that you are selling this to in order to have success. Next slide.
I think that's key, Laurie. I think if the place where it seems like advanced care planning is most likely to land at your organization is in palliative care, then to think about what their burning issues are and see if those connect to advanced care planning is kind of the way to make the case, and then make the case for that budget line item if you don't have a foundation. If it seems like it's marketing, same kind of thing. I think that it's great to talk about how to connect that data and make the case, and then that's really how you find a sponsor, is it's what problem is it likely to address.
Mm-hmm. You want me to move on to where to start?
Yes.
Okay. The top of the screen says it all. Start small. You can fundraise. You can work with the foundation. You can tap into the advanced care planning initiatives toward where your organization has its goals, its mission, focus. Be sure that you pitch something that is relevant, and you're not going to lose. And also decide what kind of program makes the most sense for your organization. If we didn't have what we happen to have here, we would probably focus on our senior center, because we have a thriving senior center. And while we go to the senior center, somebody could easily be beginning there at the senior center at one of their fairs, their senior fairs, and test the waters and start working in advanced care planning with these folks. I've found that the community, the retired community in our area, they're much more apt to talk about advanced care planning, again, before there's a crisis, but because they're the place where things are more practical at times. And if you get one or two people that are excited, they can get others excited. And then folks don't want to be left out. That's what's happened with us in the community when we have these fun little 5 wishes parties. And what I mean by that is we just brought a few 5 wishes, and I invited some people to have kind of like an old-fashioned Tupperware party, you know, where you gather, somebody makes a cake, and you sell Tupperware. But instead of selling Tupperware, you have a conversation about advanced care planning and go through the 5 wishes document, and they can get it all done right there. And they are talking about it, and just like a Tupperware party, at the end of the evening, the goal is to get somebody else to schedule another party. And we've gotten great traction. That wasn't something that we ever thought we would do in our original objectives. Let's have a 5 wishes party. And that's been huge for us. So we have those group events. We also have a lot of one-on-one conversations. And so staff members, again, in the fear of missing out category, we get folks that are so excited about presenting advanced care planning that somebody else comes in and says, I want to do that too. I want to be able to have that conversation, whether it's with my family member or my friends or at my tennis group. And yes, we do that there. Find people who are passionate about those one-on-one conversations and the group teachings. And they may be the same people. For us, most of the time, they're different people. So that's where we have begun, as well as, I don't want to miss this, that having stories. The stories bring this home. When people do have an advanced care plan versus not having one, that makes a huge difference, not only to community members, but to our administration in continually having advanced care planning at on the tip of the tongue and as part of the regular conversation. Next slide.
Yes, and I'm going to chime in and move to your next slide as well. One of the things I've noticed that's been super helpful at different places getting started in a small way is clinicians, if you're noticing something that's happening, say an example, if you work on the ICU and you're noticing it seems like several times this week we've run into people where we didn't know who the decision maker was, which I know happens all the time. But as an example, one of the things you can do is if you're starting to notice there's a trend here in my days that advanced care planning might address, you can just start taking a tally of that. And that way, when you go to your leadership and say, this happened 5 times this week and 7 times last week and 38 times this month, what that allows them to do is start doing those measurements on a larger scale. Maybe your team does it. Maybe it makes sense to then get involved in a quality improvement project or something like that. So it's another way to just, you can start with just being you and noticing trends and keeping track of them.
Good words. Also, we've talked about willingness from your leadership. We want to make sure that your leadership has bought in if they haven't already. You can do some of the things we've talked about already regarding statistics, data that you've got. Highlight other healthcare agencies. We have on a link to the CBS News report from Gunderson, the Gunderson Health System in La Crosse, Wisconsin. They are the system that it seems like everybody refers to because they've gotten the data. They've figured it out where they are tracking how many of their patients, when they die, had an advanced care plan and how often the healthcare system followed it. So the 2 crucial pieces of data that you should be able to, hopefully in your electronic health record, you'll be able to track as well. Or maybe you do it more simply than charting if you're not in a health system. That's a great, it's not very long interview as well. It's super interesting and a terrific place to start, and I want to make sure that you see that as part of making the case, Gunderson also boasts the lowest health care cost in the country, and that can't be a coincidence, where over 96% of their adults have an advanced care plan, and that's from age 18 on. So those are powerful data points. What you may need to do to start is to add to your workload a little bit in order to prove that value. That's what we do here pretty regularly. As an example, that wasn't advanced care planning, but it made the case. I knew we needed to have 24-hour on-call chaplains, and so I said, for 6 months, I'll take call. And at the end of 6 months, I had all kinds of data that showed here's what happens when you have somebody on call and all of the related information. Same with advanced care planning. If you take on a little for a season and make it your performance improvement project, then you'll gather the data yourself. It doesn't have to be fancy in order to get really great data. Next slide. I want to be sure that this next bullet point is not lost. Be sure that you understand your state law concerning advance directives. Some of you have questions about what your state honors and doesn't honor. Make sure you are up to date with the most accurate information. That's where we end up getting into the clinician's view, because our state just changed its law this last July about who can be a decision maker if there is not an advance directive. And that once again brought things up to the top. It all boiled up, and our clinicians, we realized, oh, it's been a while since we've had some training for them, so we were able to do more because they're asking the questions. Test this in the community. You can see different groups that you can offer up your expertise to, and find your model for speaking. Determine whether you're speaking more from a legal perspective, or you're talking about durable powers of attorney for healthcare, living wills, the legal part, the story part. Stay simple. I've been able to convince many of our attorneys in town who didn't think that the 5 wishes, for example, was legal and binding, by having a conversation and sitting down. That's when I learned that they had never even looked at the document, so they didn't know. They just assumed that something simple cannot be legal and binding. And then look at yourself. What would you want? your last days to look like? Have you talked with others about this? Sometimes those of us that are most passionate about this work forget about ourselves. And put yourself not only in the shoes of others, but take their shoes and walk in them for you too. And what would you want? Use your stories, use your other stories, use your community, and don't be afraid. I mess up all the time, and still our community loves advanced care planning, loves 5 Wishes particularly, because I try to be authentic. So it matters. Next page. Focus also on your outpatient teams. Do that quality improvement project. Find some measure that the organization wants to improve. Get in front of physicians so they can understand. A lot of times they don't. We've had physicians tell I had a physician tell the 85-year-old woman with all kinds of diagnoses and a poor prognosis, you're not ready for an advanced care plan yet, and that's just not true. So respectfully talk with your physicians and offer that up regularly. And then embed advanced care planning in your hospice agencies. As far as key hospital teams, you can see it's just about any team. Your nursing team is not on there because that should also be obvious. In a hospital, really everybody, care coordination, the social workers and nurses that are discharge planners, the registration people, for us it's spiritual care team, and that really is a great way to use chaplains, and the palliative care team. So people are less afraid, and they have something in their pockets. The staff has something to talk about as well. Next slide. As I said, we've combined with the surprise question, would you be surprised if your patient died in the next 6 months? That has made all the difference for us because we have physicians then that are specifically answering that question, and then that leads us right into advanced care planning. So our chaplains and some social workers go in and one at a time, and the first question they ask is, what do you know about why you're here? And what's your plan when you leave? That's how we start advanced care planning. And that leads very often into a conversation about palliative care or hospice. But it's a great, safe, non-threatening way to start the conversation in a hospital. So the two go hand in hand. And we are backing out the surprise question. It's 6 months in the hospital, and it is a standard. We're the only hospital that has standardized this for every inpatient admission. And we're backing it out into the clinics now with a 12-month mark. So finally, just know we took it a step at a time. I encourage you to do the same thing. Be encouraged with where you are. The fact that you're on this call says that at the very least you have interest, and you may be even farther along than we are. That's awesome. Keep track of your steps because you may forget how successful you've already been. And just know that any step ahead is a success. That's what I have.
We have a few minutes for, thank you, Lori. That was really helpful. I love so much of what you talked about. And we have a few minutes for questions now. So I'm hoping if anybody has anything they want to ask that they can use the comment section and ask their question. There are a couple that have come through while you were presenting, Lori. Here's one that I think is a really good thing to ask. You were talking about being familiar with state laws. And there's a question about who is the best contact within a state when you're trying to understand state laws. And I don't know if Paul or Lori, I know there's a lot of information on the 5 Wishes website about that, but do either of you have a good answer for our participants there?
Sure, I can jump in. This is Paul. We were fortunate at 5 Wishes to work with the American Bar Association's Commission on Law and Aging that helped us with our research on 5 Wishes. And today, 5 Wishes meets the legal requirements as an advance directive in 42 states. That's printed in 5 Wishes, and the information is on the 5 Wishes webpage. But that website at the ABA, if you look for American Bar Association Commission on Law and Aging, has a real deep deck of resources and tools and research on legal analysis. So that's a great place to look, and also your State Department of Health website is another good resource.
I had somebody said they tried to use the link on the left, so I just added another one. That's a link to the Five Wishes website where you can find more information that Paul was just mentioning. One question that we've had come through here is, Laurie, how did you specifically, you talked about making the case with your foundation for them specifically to, I guess you'd say, invest in Five Wishes. How did you get to that point? I mean, what was actually the ask?
Well, as I said earlier, the way I started was, can we have a few? And then I used the data, the information that I already had, the national data, and then I tried to actually involve the folks in the foundation in some of these events. Hey, why don't you come with me as I go talk? And you can see the importance. And so they have gotten to the place now where whenever we get close to running out, they will purchase more for us, just because there's so much value in the community. And like I said, we've invested in 100,000, but we have a community that's a couple 100,000. So we're only halfway there. And I fully recognize that there are going to be some that start their advanced directive and then don't complete it. But there are so many that are then calling their friends and contacting others. But the foundation sees that. They are so interested in the stories that when they hear more stories, they then go out to folks that could be donors or are current donors and explain, here's what we're doing with advanced care planning. And this is something that you seem interested in. Would you like to invest as well? And so they've become the workhorses for getting the money, so that's just not even an issue for us. Also, I wanted to say with Paul had mentioned the 42 states. One of the states that does not recognize Five Wishes is Oregon, and yet we've worked with their hospice and palliative care, their state hospice and palliative care organization, and they have said because we have a lot of folks that are snowbirds from Washington down to California, and people have said, well, if Five Wishes isn't valid in Oregon, what should I do? And they have made the declaration that you should still have it, because if you are in Oregon, we'll honor it. So if you are an Oregon resident, they have a document that's been legislated by the state, but if you are from another state and you've completed it there, make sure you have it, because it still will be valid.
Laurie, if you can answer this one real quick, and then I'll make a few closing remarks. But if you can take a few seconds, we've got one question that I think is great about how did you get your chaplains on board? And she's saying that it seems like a natural connection, but she's had some resistance. And I think in some places that resistance is whoever you're asking. But any quick keys to success with that?
You know, for us, we are a non-faith-based organization, and to have 12 chaplains is kind of a big deal. And I just went with the Medicare model of chaplaincy. So we are going in with a spiritual, not a religious perspective, and asking those questions that I had mentioned before. What's going on, and what is your plan, in an effort to walk where the patient is to where they want to go. And this falls in line so readily that even those that had no religious background completely bought into the chaplains. And for the most part, we call them spiritual care providers. But I will tell you that for those that do have a religious background, all of our chaplains say that they are able to do such what they call fulfilling ministry in this somewhat covert way. They're not proselytizing. They're not trying to get people to become part of their faith. This is huge for them.
That's very effective. I appreciate that. I want to thank you all again for participating. We do have a few more questions which we'll try to answer by contacting you. One thing I would like to point out is I would ask that all of you stay tuned to the 5 Wishes for Healthcare webpage, which you will see under the links on the left-hand side of your screen. One of the things that we plan to do is post on the practice community page of that website some links to research like what we've been talking about, and we've had a few great comments, particularly from Roberta, who's wonderful with this stuff, about some other sources of research to help you make the case for advanced care planning initiatives in your organization. So stay tuned. We will send you a follow-up with that information. We also want to remind you that if you have a need for information about 5 Wishes products, if you're interested in some of the components of the program, please send an email to Joanne, that's Joanne, at 5wishes.org. That's FIVEWISHES.org. If you have a story about something you're doing that's great, or you want to learn how to measure something, or you're interested in digging into your program, email me at Kathleen, that's Kathleen, at 5wishes.org. And we'd love to hear from you. Thank you again so much for your participation today. I'll hand that over to Kate.
Thank you. And with that, we must conclude today's program. The session has been recorded and will be available within 3 to 5 business days. You may access the recorded archive by using the same login information you used for today's live webinar. Feel free to share the recording link with your colleagues. On behalf of the 5 Wishes, thank you to our speakers and, of course, all of today's participants. Have a good afternoon. You may now disconnect.